We're never a better health detective than when we're on that journey for ourselves.
I had several different layers or different triggers that then cascaded into issues with my thyroid and developed into Hashimoto's. I grew up in quite a volatile household. My nervous system just was on high alert all the time. And what happens, of course, suppression. I got bouts of tonsillitis, multiple rounds of antibiotics. My gut microbiome, my immune system was already compromised right from the get-go. The wanting to please, perfectionism, working hard, they were coping strategies. There were ways in which I could survive. So we worked on guts, immune regulation, and actually the Hashimoto's went into remission.
The doctor can go and do a functional medicine course. They can learn the protocols, the tests, the supplements, the diet. But if you have lived it and you have that genuine experience, it's a whole other level of learning.
And that deep compassion from going, I know how it feels to be where you are, with your brain fog, with your energy on the floor, because I've been there. Because in functional medicine, it's all about the story, isn't it?
So, Gayle, thank you so much for joining. So, Gayle, you're one of our advanced functional medicine practitioners at the Forbes Clinic. And I had a look through your story because we've been working together for a while, but I haven't actually, we haven't done that where we've gone back in time and actually found out really how you came to be what you are today. So it's fascinating reading back through your story and having the pleasure of speaking to you today. So thank you so much. Let me ask you first of all, then, let's go back in time. And could you take us back to the point at which your own health started to shift, what was happening in your life, and what did you first begin to notice in your body?
Goodness. Well, thank you, Anna, first of all, for allowing me to share my story today. And when you first asked me to do this, I just went, instinctively, my hand went here to my throat and I went, there was a little internal voice that went, who's going to want to listen to this story? And from that, it was a bit of a light bulb that came on and going, but it's so important to know people's stories, know their backgrounds.
Exactly.
In functional medicine, it's all about the story, isn't it? It's all about
absolutely
what set up the scene for, something to come along. And I had several different layers or different triggers, as we call it in functional medicine, that then cascaded into issues with my thyroid, which is why I put my hand there, and developed into Hashimoto's. So thank you for that, because it was a revelation for me to kind of go, this is the seat of it. And so in my story, I suppose, it's the story of my thyroid. And it's going all the way back to my very early years, because a lot can set the scene in our early years. And I grew up in quite a volatile household. It was an unpredictable place to live. My dad was, how would I describe him? It was like living on my nerves. It was like walking around on eggshells. I never knew what kind of mood he was going to be in. And I think if anyone's ever lived in those kinds of circumstances, you know how that can feel in the body. And to a small child, you don't really understand what's going on. There's just this inattention all the time and an activation in the system. And of course, we've got a developing nervous system at that time and a developing brain. And my nervous system just was on high alert all the time, as in what mood was going to walk in through the door.
And was that alcoholism, or was that just an emotional trait for him?
That was an emotional trait. And it's kind of the manifestation of his own trauma. And of course, with my adult eyes on now, I can see that that's the case. However, as the child, you don't really know or understand what's going on. So yeah, it was his unprocessed traumas that then he was continuing to play out. He just couldn't manage his own emotional responses. But that just meant that I wasn't able to learn to switch off that hyper-vigilant state. So I went into a state of hypervigilance as a child. And also, you know, some of the coping strategies that develop from those experiences can be, because we don't want to look at the parent and go, there's something wrong with you. The child goes, oh, it's catching here in the throat. You can hear it. The child goes, well, what have I done? What have I done wrong? Because it's inconceivable for a child to think that it's the parents' fault. You know, the parents are the parents. They're there to take care of
So
him.
true. They're like gods at that age, aren't they, to the child?
Yeah. So what have I done? And, you know, when I think back to it, and it's such a privilege to kind of think about pulling all of this together for this conversation today, because it was like, what have I done wrong? And that sort of that questioning and that internal struggle went inwards, and the expression of my fear didn't ever go outwards. I clamped down. You know, in the 70s, in the 80s, when I grew up, we didn't talk about these kinds of things. We didn't talk about my dad comes home and he's in a bad mood and he's thrown his dinner in the fireplace, and various other, you know, incidences that I don't really need to go into, but we didn't talk about it. It was shut down. And this is the seat, isn't it, of our expression in our throat chakra, in the thyroid as the gland that holds this energy.
And in mind body medicine, that's how they look at the thyroid conditions, isn't it? It's very much about expression.
Yeah, exactly that. And so what happens, of course, suppression. I got bouts of tonsillitis, one after the other, you know, and I was on that awful pink liquids, you know, antibiotics, multiple rounds of antibiotics over the years, to the point where they were saying, we're going to take your tonsils out. But I was very strong-willed, in a quiet way, of course, the quiet good girl way. And as soon as they said that to me, something in my system just stopped me having tonsillitis. It's really remarkable.
How interesting.
So, like, with my functional medicine head on, and I look back at that time, I'm going, okay, we've got a scene set there of what we call adverse childhood experiences. And that's a really real, you know, group of experiences that can predispose us to more chronic illness when we're in our later years. And also round after round of antibiotics. So my gut microbiome, my immune system was already compromised right from the get-go because of this, you know, mind emotional response to what was going on at home. So what
I was just going to say, that's what I find sorry to interrupt. That's what I find fascinating about the integrative approach, because it's not any one thing, it's multi-layered. So, you know, we had in your case, we had that obvious mind-body connection linked with that adverse childhood experiences, but at the same time, the very physical the physical causative factors of multiple rounds of antibiotics depleting the gut microbiome and allowing for changes on a physiological level. So you had both going on. And if you went to see just a mind-body medicine practitioner, they would work on the first thing. If you went to see just a physical practitioner in the functional medicine realm, they would just work on the antibiotic and the physical side. But actually, you know, both are needed, aren't they? And that's why I love working with you, Gayle, because even though you're really high level functional medicine trained, you have this really strong appreciation of the mind body and energetic connection as well. So sorry, what were you going to say?
No idea now, it's gone, because absolutely. And I had a wonderful session with Richard, our German new medicine practitioner here at the clinic. And he really helped me to understand more about how that sense of powerlessness at that time, helplessness, and being in a dangerous situation was all manifesting in these physical symptoms. And because it was time after time after time, when we have these recurrent experiences of those emotions, it can then go into autoimmunity, which is what mine eventually did. But it was many years down the road when I embarked on my functional medicine journey with the wonderful Joe Gamble, where I realized that it was actually an autoimmune condition, but it started off with, yes, just being subclinical hypothyroidism, as we term it.
Yeah. And in autoimmunity, I mean, in my experience in integrative medicine, autoimmunity can never be looked at from just one perspective. It's so complex. And it always, in my experience, it always has that psycho-emotional connection, contributing factor. But then often we will see the physical factors too, like antibiotics, like toxicity. And the integrative medicine approach, obviously, we need to look at everything. So that's really great that you did that German new medicine approach, having done so much functional medicine as well. Presumably it all just linked everything together for you.
Absolutely, it did. And of course, I've done loads of work as well, because from those experiences, like I said, the good girl emerged, the let's not rock the boat, so the peacekeeper kind of personality came through, the wanting to please, so overworking, perfectionism, working too hard. So all of these, and I'm so grateful for it, because they were coping strategies. There were ways in which I could survive in that situation. And ultimately, yes, they have been beneficial in some respects, working hard and achieving and all of that stuff. But of course, the detriments to my nervous system, my adrenals, my stress levels, off the charts. And so I also then, of course, used supplements and dietary approaches to calm and nourish adrenals. But it's so much more than that, as we know. I've done a lot of work around emotional freedom technique, the tapping, the meridians. Clear some of this very physical held trauma, because I always say to my clients, quite often our biography can become our biology. And so
that's a really good phrase.
It kind of clicks, doesn't it, when you say your biology becomes your biology. And so to help to clear some of those experiences, I found the EFT to be absolutely transformational, alongside the nutraceutical support that functional medicine offers too. But
I'm so glad you found all that as part of your journey, because it is very, I suppose my one criticism of functional medicine is that it can be a bit too matter-based, a bit too physical, it still can have that focusing too much on the physical side. And then it comes down to the practitioner. That's why I love working with you, because you're working at such a high level functional medicine level, but you really do weave in the other aspects, because you know that that's so important for more of a permanent resolution, and having that understanding of one's condition is so crucial, isn't it?
Absolutely critical. Yeah. And actually, when you look at the functional medicine tree, which is quite classic in functional medicine, looking at the roots of the tree, yes, you've got diets, but you've also got stress in there. You've also got movement in there. You've got sleep in there. You've got relationships, because toxic relationships, my goodness, can be absolutely...
It can be everything. One's relationships can be everything. I agree with you. I know it's in the functional medicine training, but unless you have been on a personal emotional journey yourself, or a self-development journey, or you've trained as a psychotherapist, then actually just saying, just look at stress and just move more and just meditate, it's not coming from as complete a place as it could be. So that's, for me, why it's so important that practitioners have actually been on that personal journey, not just on the physical, not just done the antimicrobial herbals, and I've done the kill off, and I've done the probiotics, and I've done the diet and do my exercise, but they've really dug deeper, which is what you've done. And that's why you're able to work with patients in such a deeper and more authentic way, I would say.
Thank you, Anna. Thank you for recognizing that, because it has been a lifelong journey, and I
Yeah.
continue to be on that journey as well. And I've got a very strong sort of spiritual aspect as well. So even back then as a child, you know how children get Bibles given to them at school? Well, they certainly did in the 70s and 80s. I used to sit and read the Bible and like talk to Jesus. And I used to do, and I'll probably sound really strange now, but I used to do like eye gazing meditations in the mirror. So I already had this kind of sense of being supported and looked after, and a very strong faith that I was always going to be taken care of and guided in the right direction. Just came from,
Amazing.
I don't know where, but it was just there. It just appeared. And
It
that,
wasn't in your family. It wasn't, you weren't indoctrinated. It just came from within.
no, I'm
Yeah.
quite different in those
Yeah.
ways. Yeah.
Yeah. It's interesting. I often see, for whatever reason, I attract into my practice really natural sensitives, true sensitives, you know? And so I see a lot of them, and often it is this journey that you describe, and you're clearly a natural sensitive. So someone who's very deeply sensitive naturally, coming into the world, into a family that doesn't know how to support that, how to guide that, how to nurture that. Now, what you described with your dad being so unpredictable means that the child feels unsafe, like you said. It means that the child feels out of control, as in, you're not in control, are you? A child in a safe space should know that, actually, if I do this, this, and this happens. You know, mummy gives me a smile, or daddy gives me a pat on the back, or, you know, oral, whatever. You know, there's some sort of predictability. You know, if I scream and shout and, you know, smash a glass from the table on purpose, you know, there will be a consequence. There's some predictability. Whereas with the unpredictable parent, we actually feel we're never in control as a child. So what that means then is we can go looking to feel more in control. Now, how do we do that? We go into our conscious mind, and we overdevelop the intellect. And this is what I see so much, and it sounds like the same thing happened for you. A true sensitive who didn't have their sensitivity appreciated, guided, nurtured, supported. And it's such a gift to be a true sensitive, because you can see things other people can't see, you can feel things other people can't feel. But in our society, it often isn't appreciated. It often isn't held up in as good regard as it could be. So it's seen as a weakness. So probably in a family setting like you've described, it would have been seen as a weakness, and you would have quickly started to perceive it as a weakness. So therefore, then we move out of the sensitivity. We say, well, that's not serving me. And actually, it's just leading to pain time and time again. So then we go into the intellectual mind, which is more predictable. We feel we can control it more. You know, we can work hard, we can jump through those hoops, we can say clever things, we can get the exam grade or whatever, particularly if we have that competence, we have that capacity to do so. It's like, oh, great, I know how to then control the outcome through my intellect. But then the body mind comes in, as it did for you, and this is where we look at the meaning of illness. Through that process, you had to go back inside, reconnect with that sensitive part, bring it to the forefront, and honor it and say, you know, you are part of me. And actually, you know, go back into that sensitive part and use it for what it's meant to be used for, which is, like I say, you see things other people don't see, you feel things other people don't feel, which is a wonderful, wonderful characteristics to be a very effective and skilled practitioner. So we talk about, I don't know if you've come across this term, but certainly in my psychotherapy background, we talk about locus of control. So the child who is in a very unpredictable upbringing, they develop this external locus of control. So instead of being an internal locus of control where we feel empowered and we feel like we can almost, you know, we can guide our own destiny. Some of the external locus of control needs that external validation. So hence the intellect comes in and we jump through the hoops and do the exams. And get the external, seal of approval, etc. But actually, the external locus control is linked with chronic health conditions, depression, anxiety, etc. So what you did through your self-development journey, because this is what you did both, Gayle, clearly. You did the physical health through the functional medicine side, but you also very much did the self-development journey to re-empower, reconnect, and develop more of that internal locus control, where you feel like, actually, I know how to guide my life, and I'm not relying on outside forces to tell me which direction I'm going to go in. Sound about right?
Sounds absolutely spot on. And also, there is this kind of otherworldly, spiritual kind of, so it's not external control, but there is information that also comes in, as well as that still quiet voice within us that is guiding us. And that voice spoke to me a number of times, whether it's here, it doesn't matter, but it's guided me, as in, see this practitioner, make this choice. And so after years and years of teaching, which you can imagine was exceptionally stressful.
Yes, you were a teacher for years.
For years. I mean, my adrenals were off the charts. I taught in a secondary school. I was leading behavior management in the school. I was also training in other schools, going to America, bringing back trainers. So it was quite high pressured. And then I also ran an alternative education provision as well. So very at-risk children on the edge of exclusion. So lots of issues there. So there was huge amounts of stress. But then there was this voice again going, no, we need to change this up. And so I just left and I went traveling for a year.
Yeah.
And I suppose that the reason to bring that in was, this is another kind of part of the scene where 6 months of antimalarials, doxycycline, antibiotic, also then just added more kind of confusion in the system.
Depletion as well. Depletion,
exactly.
Yeah.
And there was coupled with some food poisoning at that time as well. So all of this is leading up to the autoimmunity.
Yeah, the gut got decimated.
Totally obliterated. I mean, I remember taking those antimalarials, because we went to the Amazon, we went to rural India, we went to some really odd, far-flung places. So at that point, 2003, I'm not going to be, I didn't know any of what we know now. And there's absolutely a time and a place to take antimalarials, I'm sure. But at that time, that was my choice. So there was that confusion in my system. And then I went back to the teaching, and it was stress back again. And then several years later, about 2008, that voice came in again. But and it was one of those, those life-changing moments where everything just spins 180. Have you ever had one of those?
Yeah. Pivotal moments.
Well, I went to a gong bath. The big metal instruments and Tibetan bowls. And I was lying down in that gong bath, and I had the most excruciating stomach pain. Like, I wanted to run out of the room. It was so awful. And interestingly, then it flashed into a memory of my teacher sitting me on her lap, rubbing my tummy, because I was stressed from an argument that had happened at home, not with me, with my parents the night before. So it just started to show itself again. I thought, I'm not going to run away from this. This is an aha moment of, there's something in this sound therapy, in this frequency medicine, that is trying to show me something. And that was a life-changing moment, because I started to myself work with the gongs, work with sounds. Within a few months, I'd left my job. I'd left my marriage. too massive, the way I defined myself and the way I'd lived my life just absolutely dropped away.
Yeah.
And then that led to about 10 years where I devoted myself to sound therapy and led training courses and went into hospitals and psychiatric units and
Amazing.
worked with children on the autistic spectrum and various different communities, with the most incredible results. And sound frequency, as you know, we both are so passionate about it, and how that can help to really, well, I always describe the gong as, the vibrations literally pass through every, the emotional,
Yeah.
and
Absolutely.
every body.
Yeah.
And anything that is a point of resistance, be that in the psyche, in the emotions, in the body, gets gently sort of vibrated to then start to go, I'm coming up, I'm ready to be seen,
It's a
I'm
release.
transformed. Yeah.
Yeah.
It doesn't always look pleasant, does it, when that happens?
No.
Can be quite.
That's why I love frequency medicine, because your intellect doesn't get in the way at all. It just happens. Even if the root cause was some psychological, psychoemotional trauma, or even a toxicity or a pathogen, actually the frequency medicine can still shift the terrain to be able to do what the body can do to overcome all of these things. And you don't need to understand it. It just does it. It's amazing.
During that spiritual phase, where I was with the gong and all of those sort of healing frequencies, I used to meditate a lot. And in that time, I was given the term integrative medicine, and I had no clue what that was.
You mean as a message? You mean as a message that came through internally?
In a meditation, I'm like, what is that? But I knew it was significant because I wrote it down. And I had to go and research what it was. And I went, oh, okay, whatever. But it wasn't in my reality at that point. And then I studied nutrition, And it wasn't until I was on a call with you when we were talking about me coming on board at the clinic that the penny dropped. And it was, oh my goodness, this is the clinic that I'm joining.
That's amazing.
Integrative medicine clinic with all of these different specialists, practitioners, the whole mind-body team. And it's like, my goodness, 20 years later.
That is amazing.
I'm here. So I'm not saying this is the end. There might be another adventure. There might be another pivotal moment. I might get directed to
life.
Who knows what. But that was, I just wanted to share that with you because it was such a blessing to realize that had actually come to fruition.
That's amazing. That message came through to you and you'd never even heard of integrative medicine. Yeah. That is very in tune. And actually, Gayle, you are a fully fledged integrative medicine practitioner. I know, we're using the term functional medicine practitioner, and that's partly because you're working at such a high level within integrative medicine, within functional medicine, but it's also public perception. So a lot of people are looking for functional medicine, they get their head around functional medicine, but actually, to my mind, for me, integrative medicine is that further step. And if you can have high-level functional medicine within that, and that's what our clinic does, isn't it? It's integrative medicine approach with working with a high-level functional medicine approach. But actually, because you have such a deep understanding and appreciation of the mind-body connection, of energy medicine, and of the spiritual aspects of being human, that's the completion. That's the completion of a fully fledged integrative medicine practitioner. So anyway, something to think about, because actually you're way more than a functional medicine practitioner, to my mind. So
yeah. And so my life just, it was the most, peculiar, amazing, magical adventure for like about 10 years where I was doing all of that kind of, frequency experimentation. But during that time, this is another pivotal moment that kind of then brought me more into the work that we're doing. My beloved stepfather It's still here, and I'm sitting in his chair.
Oh,
So
bless you. Take your time.
he's with me today. He and actually, Keith, his name is. I'll use his name. He he was actually my godfather when I was a little girl, and he was so wonderful that I always wanted him to be my dad. So I prayed that he'd be my dad. And then one day, when my parents eventually separated after 30 years of being together, Keith came back into our lives, and my mum married him.
Wow. Oh my goodness. You got your wish.
So my wish came true. So my godfather became my stepfather, and Merchant is his name. I took his name.
Oh,
Yeah.
wow.
Yeah. So he, in 2013, developed a brain tumor, glioblastoma. So I was, of course, fix it, because that personality trait was still there. And so I started researching, and I just didn't really know what I was doing. And on reflection, some of the suggestions probably weren't that helpful, but I was doing my best with the tools that I had at that time. And then it was my sister, actually, that pointed me towards the College of Naturopathic Medicine and Nutrition. And she said, you know what? I think you might be interested in this. And I had always had an interest in nutrition. It was true.
When was this, Gayle? When was this?
2013.
It was 13. Gosh, so you've lived about 2 different lives so far, and now you're going into your 3rd life.
Do you know, I said that once at a group event, and the gentleman who was leading it said to me, you know, a lot of evolved souls do feel that that's their experience, many lifetimes within one lifetime, and it just feels so true.
Definitely. Yeah, got to move through a lot of different things. Yeah.
So, bless him, he started me on the journey with the College of Naturopathic Medicine. So I studied my diploma with them. And that's where I met the wonderful Jo Gamble, who was my teacher at the Birmingham College. And she's just one of the most inspirational people I've ever met, as well as the immense knowledge and wisdom.
Yeah, big brain,
big hearts.
Big heart.
So much generosity with her sharing of her knowledge. And she just inspired me to, well, finish the course, for one, and also then to go into functional medicine. So that's when I trained with IFM as well. Sadly, Keith did pass away a year later. But, you know, he's still here. I can still talk to him sitting in this chair. And what a gift to have had, you know, that father figure to actually show me what that should have been like. Yes,
that's beautiful. With Jo, you have been actually, you had the initial training with her, kind of officially, but actually she's been your professional mentor ever since. So I think you're the only practitioner who has trained with her to such a high level over all of these years. So I know, speaking to Jo, she would say that, you know, you're the only practitioner that works in a similar way to her. You're the only one with those sorts of skills that she has imparted to you. So I always say to Jo that she should definitely have the Jo Gamble Academy or something like that, you know, to allow lots of people to train very directly under her, because she does work differently and works at such a high level. But you work at such a high level, so I'm so grateful you've joined our clinic, because we have your amazing skills to refer to as well. I just want to come back, Gayle, because this is such an interesting conversation, because there's so many different layers to it. When you were talking about the voice coming in, the guidance that you've received, we talked about the external locus control. So when I did my psychotherapy work training and then worked as a psychotherapist many years ago at the beginning of my integrative medicine journey, I was working with a psychotherapy organization. They were doing the cognitive work, so working on our beliefs, our mindsets, and it was through that we were working on the locus of control. Now, the reason I left them was because they had no appreciation of anything else. It was just the mindset, just your thinking. And it was like there was nothing else to being human, just our thoughts. And then when I had my first child, you go through this evolution, and it just suddenly just didn't. I was like, that's not right. There's so much more to us. And so actually the external locus control side of things, they would apply to anyone that had spiritual beliefs. This was another reason I had to leave, because it didn't resonate. But through all of my learning and my experience over the years, because I have had a lot of spiritual training as well and experiences, I understand where they're coming from. I think from a religion point of view, there can be that religious dogma where we jump through hoops and people jump through hoops and they are living their life according to trying to be a good girl or a good boy for God, and God's out there. The man with the white beard sitting on the cloud, as depicted in all the kind of children's Bibles, etc. But actually, when you look back at all original spiritual texts and religious texts, the truth is in all of them, which is basically that God is everything. God is in all of us, and it's absolutely everything. So feel like that's a really important differentiation to make. And you said it exactly that. It came through you. So it's not that you're waiting for something outside. It's just that we learn how to merge, and it expresses and manifests through us and guides us in that way. And it's a part of us. So there's nothing external about it. But you're clearly tuned in and are able to connect and to listen to those messages that come through you. It's another reason I love working with you. It's not just the mind-body appreciation. You also have that higher level appreciation, which is the spiritual. In my mind, the integrative medicine journey, the baseline entry point is the diet and the supplements and the testing side of things, and then the kind of the mental, looking at the way that we're thinking, our thought structure. Is it helpful thinking or unhelpful thinking, limiting beliefs? Then the deeper kind of emotional work, do we need that somatic release? Do we need to work with somatic therapists, etc., to move us through? Maybe the frequency medicine next. Because that's quite hard for people to get their head around. So that's the kind of next place of appreciation, to work at that level. And then last but not least, it's that spiritual. And now, as well as I do as practitioners, that doesn't resonate with everyone, particularly in our sort of culture. So we always have to gauge whether is someone at that point and we can speak in that way, or are we at the entry level point, which is absolutely fine. There's a lot of work to do on that. So wherever someone is on their journey of evolution is absolutely fine. But the skill of the practitioner is about gauging where they're at and where the belief system's at as well, because we can't do something we don't believe in.
Yeah. And we've got to work. We've got to meet our patients, our clients, where they're at. And it's a journey, it's not going to be a case of there's a protocol written and things just magically change. Although you can have massive shifts, by shifting diets and
massive. And that's why we always do it first, because it's just the easiest, quickest, amazing results. And people come to us in suffering and they want some symptom resolution. But at the same time, I always say to people, okay, even if the root cause is more emotional, that's a lifelong journey. We've got therapists and we can shift and move things a lot, but actually it's not an overnight thing. So we have to do that work. And then we can also do this more physical work. And the things that the symptom relief people can experience through doing that symptom relief is immense. So it's definitely the easiest and quickest way to bring about change on a health level, for sure.
Absolutely. Only yesterday I had a gentleman and he'd had 10 years of anxiety and depression, real fluctuating moods, quite crippling in ways. And he'd been doing our relaxed paleo approach, completely gone. He just said, I don't experience any of that anymore. And that's within a few weeks.
It's amazing. And that gut-brain connection. Certainly on my journey, when I had my first child and went on that gut journey, because he had colic and reflux, and I did the GAPS diet and gave everything up. Actually, the first thing I noticed through giving up gluten was my mood improved. And it's such a common story, isn't it? Because I had always been someone that been pretty up and down emotionally. And actually, as soon as I tended to diet, that really stabilized. So this is a fascinating thing with the integrative medicine. We're working on all those different levels, but yes, so much can be done through the physical. So tell us a bit about what your journey was. We've heard the really interesting parts, the kind of, the more sort of multi-dimensional parts maybe, but tell us about the physical journey. So what you had to do to get your thyroid back on track and whatever else you were struggling with.
So it's when I started working with Jo, so when I was a student, that she unearthed the autoantibodies with the thyroid. So that's when we knew it was autoimmune.
Hashimoto's.
Yeah. And so from that, I did some testing around what was going on in my guts. And there was some dysbiosis, there was some imbalance with bacteria, and there was a couple of parasites there. We tested my adrenals, and no shock there, they were off the charts after all those years of teaching, despite all of the sound frequencies that I've been doing, despite all of the yoga and meditation. But there it is. They hadn't had that. And I've got to look back in the story and go, well, look, that was my early years experience and my nervous system retraining.
Yes. Yeah.
So we worked on guts, immune regulation, did all of that, really went to town on supporting and nourishing the adrenals. And actually the Hashimoto's went into remission.
Amazing.
The thyroid.
Had you had to do medication or not? Had you gotten away without medication?
Yeah. No, I went to see the GP for some testing and they said, no, it's not until your TSH level's 10, that's what they said to me at the time, that they would consider medication for me. So they weren't willing to prescribe it. I wasn't keen on taking it. It can be helpful, but my preference was, can I do this another way, first of all? And so, we did. We kept the thyroid stable. The Hashimoto's went into remission. And of course, that's an amazing moment. But the thing is with some of these conditions, life can then present us with more what we call triggers, more, life events that can sometimes then cause a little bit of backsliding. I think... sometimes people come to me and they think if I do this and do this and this and this, healing just goes in this straight line. And it doesn't always do that.
Not linear. Relapse is part of change, I always tell people.
Because symptoms can get worse, can't they, before they get better? Sometimes have these Herxheimer reactions, healing crises is one of the terms.
And the mind-body connection, life events.
Definitely. And I think it's about us, walking with our patients, our clients, and understanding where their kind of almost weak links in their chain might be. So for someone, it can be, environmental toxins. Some people, it can be stress. What's the things that then cause a bit of a backslide for that individual? So what happened for me, I'd had another one of those moments which said, leave your job. Leave Northamptonshire after 30 years. And I moved back home to my mum for nurturing, for, healing, just coming back to myself. And the kind of the little context around this next part of the physical journey lies in the room that I was in was next to, on the other side of the wall in the hallway, was some smart meters. And I had an EMF reader, and the EMFs, the electromagnetic frequencies, were off the scale, of course. And I tried to get the meters removed, but the company was having none of it. So I fitted some Faraday cages, which then lower the frequency.
Wow.
And on the side in my bedroom, I hung some radiation material. That blocks it out, and I used the EMF reader, and totally fine. There were no frequencies, so I felt safe to sleep in that room and to work in that room. And so I did that I stayed with her for 9 months while I was looking to move here in Forest of Dean, which is such a wonderful location. But what happened, as mums do, they like to clean behind beds and things like that. I'm embarrassed to say I didn't cling behind the bed. She pulled it out, and this was after a few months, and happened to sort of, the material moved, and what she saw behind there was black molds
Okay.
all up the wall behind my headboard.
Yeah.
So I had been breathing it in, day out for months. I remember taking a photograph of it and sending it to Jo, and she just said, "Please tell me that isn't your bedroom." But it was.
Yeah.
And so consequently, I tested my urinary mycotoxins that come from the toxins from the molds, this. And they were incredibly high. And my autoimmunity had been re-triggered.
That.
Yeah, so that was 3.5 years ago, and the antibodies are still elevated somewhat, and I am still detoxing from the mold. I think it's going to. So, in answer to your question, yeah, I was in remission, but now these external circumstances put me back there. And this stuff happens, doesn't it? Life, like you said, life does happen.
Mold's a tough one. Mold is a tough one anyway. And once we are primed with a condition, once that pattern is started in our body, it is so easy to get re-triggered back into that pattern. So we always need to be mindful. So, I'm sure you say the same to your clients. When I'm working with people, I'm always saying, you're never going to be able to, so, you've done all this dietary work, you're being careful with your lifestyle, you're never going to be able to go back to living a kind of a really normal, kind of carefree Western life and not caring about these things, eating whatever you want. Actually, that's not the journey. The journey is learning how to manage your system, learning what your system needs. And we've established you're a very sensitive person. So you are, and that can be on an emotional level, but it's always reflected on the physical too. When we're sensitive, and that allows us to pick up things, both good and bad. So it's about learning your system and how to manage it.
I'm absolutely convinced that one day those autoantibodies will be coming back down again. But what's most important to me, Anna, isn't what a test is showing, even though it's such a powerful diagnostic tool and informs, yes, what supplements I need to be taking, and yes, some other really pertinent information. Like, I'm really quite vigilant about having my dehumidifier, keeping the humidity low so mold doesn't grow. I ripped out all the tiles in my ensuite because I saw a speck of black and just put those. I'm vigilant. I'm doing everything on a practical level. So it's not
because you now know your aggravators. You now know what your insults are that you need to really be careful with.
And the mold was obvious there, but sometimes it isn't obvious. And so when people come with, autoimmune conditions, I'm like, okay, tell me about all of the history, but what's going on with your gut? What's your viral exposure been? Have you been exposed to mold? What's going on in the oral microbiome? It's like we need to look at that whole panacea of different possibilities. But for me, it was mold. But it's everything. My dad included. Everything has been a teacher and information, and it's that gratitude for all of the journey. And I wouldn't be where I am today, in my connection and in my sense of wholeness and completeness and peace in my cell, my being, had it not been for all of this.
Yes. So it makes us better practitioners. You can go on a course, and if you had, like, a nutritional therapist can go and do a functional medicine course, a doctor can go and do a functional medicine course. They can learn the academics, they can learn the protocols, the tests, the supplements, the diet. But if you have lived it and you have that genuine experience, it's a whole other level of learning. And it makes us such better practitioners because we really get what the person is going through. We have that much deeper empathy and compassion, which we really get it. But B, we're never a better health detective than when we're on that journey for ourselves, because it's down to us, isn't it? We have to fix it for ourselves. So then that means that we can go so much more easily into that health detective role with another person when we have that experience.
Absolutely.
The best practitioners have those experiences. That's what I've seen.
And that deep compassion from going, I know how it feels to be where you are, with your brain fog, with your energy on the floor, because I've been there. So it's, it also my own journey, our journeys mean that we can actually really, yes, we've got that empathy, but we really understand what it feels like to be in
and what it takes to get well.
And what it takes.
The commitment and the different, it's no means feat. It's not for the faint-hearted, is it? It's a real commitment and an investment of energy and time, etc. But yeah, I definitely see the best practitioners have those real lived experiences, for sure. So, and also the other thing and you touched upon it, Gayle, is actually, and we're taught this even in conventional medicine, even as a medical student, I was taught this, maybe not as a medical student, but certainly as a junior doctor, don't treat the test, treat the patient. And we see this in thyroid all the time, don't we? Thyroid disorders, actually numbers can be all over the place. The patient can actually be okay. And likewise, numbers might not be too bad, but they are exhibiting some thyroid symptoms. So it's not getting stressed out by the numbers too much. It can use it as a guide. The most important to the clinic is the clinical picture.
Yeah. And sometimes I don't even test. If symptoms are feeling resolved to that person in front of me, do you test again? Are you feeling okay? So exactly.
So what would you say, Gayle? We heard, your story, which you so generously and shared from such a heartfelt and genuine place. So I really thank you for that, because actually, it's not easy, is it, to bear all, particularly in that professional setting. But for me, I just feel it's so important for our patients to really see that, we're humans too, and we get what they're going through. So I feel that's a really important message. But where has it, because like I say, you really do work at this very high level in functional medicine. I mean, just take us through. So just take us through the training and qualifications. Like I say, the most important thing probably is having been Joe's, number one student all these years, or mentee, sorry. But, so take us through the training that you've done to date.
Oh, so my diploma in naturopathic nutrition with CNM, and then my qualification, my certification with IFM, the Institute for Functional Medicine. And I've done other sort of mini courses, and I'm thinking about whether to go into more of a mold speciality as well.
Yeah.
So yeah, it's the functional medicine really that has been the most recent. A few years ago, I think I did that. So it's probably time to do another course.
And what would you say? So, and it might be hard to say, but what is your approach with patients? What do you find yourself doing a lot of? Do you have a sort of step-by-step process? What do you find you're working with the most? What are you most passionate about working with? Can you give us a bit of an idea about how you work compared to maybe another functional medicine practitioner? If there's anything that's specific to you, or that you niche in, or that you really love working with?
Oh, do you know what, Anna? I am very much, whoever is drawn to come and work with me, they're the people. It's not the condition.
Yes, exactly. Good answer. Because I refer to you for everything. So, yeah, I get that.
Yeah, it really, really is that, because I think it's a certain person that is going to resonate with what I'm saying, because I do work on, really solid functional medicine. I mean, gosh, that is
science,
my bedrock, my science. But getting to as Joe calls it, the why, and digging deep and getting the answers. I mean, I get really fired up about that. And also all of the mind, emotional, spiritual,
the more holistic side as well. Yeah.
For me, it's all of it, with the functional medicine really as my
Yeah.
bedrock, my
Yeah.
solid ground.
Yeah. Yeah. And that is the skill of the practitioner, an experienced practitioner, making that judgment call and tuning into what the person in front of you wants. So I have no hesitation sending someone to you who, you know, doesn't give a damn about the spiritual, isn't ready to work on anything psycho-emotional, but just really wants, you know, someone really experienced and working at a high level on the functional medicine testing and supplementation side of things. Because actually we can work, so the way I worked for years before I had this wonderful team around me, it was a more general naturopathic way on the integrative medicine side of things, from the physical side, because my origins was more in the psychotherapeutics and the conventional medicine, obviously, but on the integrative medicine side. And so I'd go full hog on the diet. You know, so I would be, you know, no, you really must do the paleo, you must do the paleo keto. Whereas actually, when you have more skill as you do on the supplementation side and the functional testing side, I find, yes, diet is super important, but actually I find with that higher level of knowledge, you can be more targeted rather than people having to put so much effort into the diet. You can, there's a little bit more leeway because you know exactly these very specific supplements to use. So that's what I love about working with you, is I can really refer for the deeper testing and high level supplement knowledge as well. So amazing. Thank you so much, Gayle. It's been really such a pleasure talking to you and doing that, you know, quick but very comprehensive 360 view of health in general, as demonstrated by your own life, your own journey, and makes it very clear to me, having this conversation with you, as to why you get the amazing results that you do with patients. So thank you so much for joining us today.
Thank you, Anna, and thank you for listening to my story. I really appreciate it.
Bless you. Thank you so much for sharing.